Chris Walker, Emergency Preparedness Coordinator for the Hamilton County Health Department, joins me now. Good morning.
Morning, ma'am.
So we've seen some record high numbers of positive cases at the state level this weekend. Can you kind of walk us through that and help us figure out what that we can attribute that to?
Well, I will do my best with the information we have available. So hopefully my screen is showing right now, and this is current as of noon yesterday. So we can look at, there was a lot more blue, which indicates lower positivity in the population. That shows the overall quote unquote health of the community as it relates to COVID. And that's one of the metrics that Dr. Box has set out for kids staying in school and things like that. So if we go back to this page over here, we can see this is from the 3rd. If we go back down, we see there was a whole lot more blue on this map.
Yeah.
Just, 9 days ago than there is today. Sorry, I clicked the wrong one here. There we go. Okay. So we're back on today's map, or yesterday's map, technically 10/4. So that's a week old for this data here.
Looks like they're really wrestling with things down in the southern part of the state. It'll be interesting to figure out what's happening there.
Yeah, and it's tough to say. I wouldn't dare venture a guess. I mean, we know Kentucky is a lot lower than us as far as their statewide rates. I'm not entirely sure. I wouldn't want to venture a guess and be completely off the rails on my guess there and give out that bad information. But what we can look at down here is the 26th is the day that the governor moved us into stage 5. There we go. So here's stage 5 entry, and we can see that line really jumped up really fast. There's probably a number of factors. Businesses are opening up. Restaurants and bars were able to open up more. Now, they were still supposed to maintain social distancing. Staff still supposed to be wearing their masks. Clients are supposed to be wearing their masks when they're not at their table, sitting down eating or drinking. So there's probably some other things going on, but statewide, we're seeing a pretty big jump. And I think it was Saturday, we saw the 1-day record. It was 3 days in a row. I think we broke the record, but the peak has been Saturday at 1,945 cases, which is pretty significant.
So how are we doing specifically in Hamilton County?
Yep. So what we'll do is we'll filter out, and anybody can look at this site. If you haven't seen, here's the address up here. It's coronavirus.in.gov. And this is the dashboard and map that it brings up. And I apologize. There we go. Now it's reset to, this is just Hamilton County here. So we can see that Hamilton County's not jumping up at the same rate. Let's move back to the 26th here. So there's the 26th. We did see a big uptick. In this day right here, I think it was 10/1, we had a lot of cases reported. It's our understanding that a new lab had come online and dumped a bunch of information into the system. When we see anomalies like that, and that's not the first day we've had that happen. You can see a couple here, pretty high here in relation. That's typically someone dumping in a bunch of old data, and we can't really account for that. It's the day it gets reported is the day that it gets registered and accounted for at the county level. So that's, kind of what we deal with. And that, but, also throws off our 7-day moving average as well. Yeah. So that, that should be falling off this week. I mean, we still have a couple high days, but you can see we're not growing at that incredible rate that the rest of the state is. Right. So hopefully the folks here locally are continuing to wear those masks out in public, keeping their social circles small, and doing everything right to get us through this and keep us moving in the right direction.
Well, talking about moving in the right direction, we're a couple months into our Show Some Class campaign in an effort to encourage students and their families to really, live by that class acronym to keep numbers low and keep kids in school. Show us how those numbers are looking, because I think we've got a little bit of a win there.
Sure. So this data right here, this is all pulled off of that exact same website we just about. It's down further on the page. We just uploaded on whichever day it is, but this is the data that's reported in the state on the demographic data. So the orange line here is the 20 to 29 age group, and this is the 0 to 19 in the blue. And what we see is we see this leveling off right here and the slow creep downwards. So we can come back over here and on 9/30, so the end of September, 0 to 19 accounted for 20%. They're down 0.2%. I mean, it's not a huge win, but it is a win. So, and the same thing holds true over here. 9/23 the week before, the 20 to 29 age group was 22.4. They're down to 21.9%. So we are moving in the right direction.
We'll take that.
Sorry, what's that?
I said, we'll take that win, but here's my question to you is we've been doing such a fine job. The kids seem to really get it. They want to be in school. And honestly, I don't think a lot of school districts thought we'd get this far, but now fall break is upon us. What ideas or tips or suggestions would you give to people, especially those who are planning to travel outside of the immediate area?
Well, the big thing is, you know, obviously, number one, we probably wouldn't recommend traveling outside and expanding your social circle. But if you are going out of state or even out of town, make sure you're continuing to wear your mask. Make sure you're still social distancing from people that are not in your social group. You know, do everything you can to limit your exposures to people. More than 6 feet away, less than 15 minutes from people. You know, those are things you're going to do to prevent yourself from contracting it or, you know, worst case, spreading it. You know, and then along with that, you know, we have testing available if you do have symptoms or you feel you need to get tested. You know, we do have our OptumServe site that's been run by the state since May. That moved to Ivy Tech. It's over off of 16th Street at door 9. It's on the second floor, but there is an elevator if you need access to it. Additionally, I believe it's 2 weeks now, we've had Trinity Free Clinic over on Oak Ridge and 146th and Carmel at Our Lady of Mount Carmel. The free clinic there has been offering testing. The nice thing about them, I think we talked about last week, is they offer evening and Saturday hours for folks. And then as of today, Aspire, Indiana has opened up a clinic for us as well. They're off of 148th Street, east of 37 in Noblesville. And they're offering early morning, I believe it's Tuesdays and Thursdays, they're open at 7 a.m. And on Mondays, Wednesdays, and Fridays, they open up for testing at 9 a.m. And then they're generally open to either 3 o'clock or 5 o'clock on those days. But when you go to register on those sites, they will tell you what times they have available.
Fantastic. Any other ideas, thoughts, suggestions for the week ahead?
You know, it's cooling off. You know, people are going to start moving indoors more. I think it's important to, you know, maintain that social distancing. You know, I know some of the dads clubs and other youth rec leagues are moving into basketball season and things like that. And, you know, we got to continue to encourage, you know, the good hand washing, the good social distancing. If you're sick, not going to games, not going to practice, not going to work, get your flu shot. You know, flu season's upon us. We understand that the flu shot's not 100% effective, but if we can reduce the chances, that's one more thing we're not worrying about. You know, and it's critically important that, you know, if you're sick, stay home. You know, work with your employer. Employers work with your employees. Figure out the solution to help keep the good business practices and help keep your doors open.
Great. Chris Walker from the Hamilton County Health Department. Thank you once again.
Thank you, ma'am.